Welcome to our fifth Human Security and Development Forum. My name is Dr. Tereza Novotná. I am a Korea Europe Center Fellow here at the Institute for Korean Studies, but I'm also a Korea Foundation Fellow at the Center for European Integration. So as we always like to say about the High Representative for EU Foreign Affairs, I'm also double-headed. So I will first say a few general remarks about the whole conference and then introduce the first panel. In the Human Security and Development Forum, we always try to combine guests from Europe and Korea so that they all can share their experiences from their respective regions. And we also try to combine the worlds of practice and worlds of academia. And this edition of the forum is quite special in a sense because it's quite an expanded edition. Not only that we will have two panels, one which will start shortly, but also later on, another one. Perhaps the other, maybe more important reason why it's a special edition, it is because we've been trying to expand to other parts of Asia. And it is basically due to the pandemic, which has been really a global event. We therefore decided it makes sense to focus not just on the Korean peninsula, but also on other countries. But the second panel later on will focus mainly on both Koreas. So let me now move more to introducing the general theme and the theme of the first panel, which is from COVID to COVAX, European and Asian views. Although Europe and developed countries seem to be at the moment in quite a good place with all the available vaccines to overcome the COVID-19 health crisis. The situation is quite different in other parts of the world, including in Asia. Yet it was initially Asia which managed the earliest stages of the pandemic overall a bit better than most of the European countries. Therefore, the goal of this event and goal of the first panel is to discuss various approaches in Europe and in Asia in dealing with the COVID-19, all sorts of measures and such, and to see how we can still help those most affected, especially all the vulnerable populations, and whether, of course, we can come up with any mutual lessons for future pandemics or, how to avert them. So for that, for the first panel, we have invited experts who focus on Europe, Taiwan, Hong Kong, Malaysia, and Cambodia, or have experiences from these parts of the world. So, I think it's quite a broad range of countries. And this will give us a good starting point to make any comparisons and contrasts. Since we have quite a number of presenters in the first panel, I will introduce everyone before each talk rather than everyone at once. So I will first ask Dr. Zsuzsa Anna Ferenczi. So just a few words about Zsuzsa. Zsuzsa is affiliated scholar at Freie Universität Brussels, so Free University of Brussels, and postdoctoral fellow, which is hosted by the Ministry of Science and Technology of Taiwan. She's an expert on China, Taiwan, Korean Peninsula, also head of the Associate Network of 9-Line, a platform offering analysis on issues affecting Indo-Pacific, and also research fellow at Next Generation Foundation in Taiwan. So please, Zsuzsa, you are the first one to start. Thank you.
Tereza, thank you so much for the kind words and for the invitation, and to all of you, a warm hello from Taiwan. I think we are a bit present here in this panel from all over, so it's pretty amazing that we can actually get together like this. Since we don't have much time, I think I will go straight to my presentation, and I will share my screen as Tereza just mentioned. Okay, perfect. Then I am just going to go straight ahead. So I will speak about Taiwan model and the geopolitics of COVID-19. So I think in order to really have a good understanding of the Taiwan experience, and because it is Taiwan, I think it's absolutely necessary that we talk about the context of Taiwan and the geopolitics that surround Taiwan. And so I think this is the first part that I will cover in my presentation. Then I will move on to, in close relationship to the context, to the perceptions of Taiwan's role in the region and in the world, as well as the level of awareness that we see of Taiwan as a result of its successful management of COVID-19. And I will then speak about the core elements that constitute this model, and then move on to what the world can, in my view, learn from Taiwan. And this is again where you will see how important it is to talk about the context, because it is one thing that we want to learn from Taiwan, but the question to ask is, can we learn from Taiwan given this geopolitical situation that we're in? So the context, well, as we can all agree, I'm sure, COVID elevated Taiwan's profile in the world and enabled it to participate in more international conversations in spite of diplomatic isolation. So Taiwan's international status, it is often referred to as a geopolitical absurdity, where the People's Republic of China claims Taiwan, whereas it never owned Taiwan. But this puts Taiwan in a very difficult diplomatic situation and isolation. But this is where I would argue that with COVID-19 and the success story of Taiwan, I think we might need to reflect and reconsider this isolation concept, because I think Taiwan is no longer as isolated as we've believed it to be. Of course, the US-China rivalry has further amplified Taiwan's geostrategic significance, and perceptions and awareness have grown. Taiwan is now recognized as a force for good in the international community because it's been successful at home. There were at some point last year about 8 months of no community transmission within Taiwan. And then in addition to being successful at home, Taiwan also was very generous abroad by donating masks, more than 50 million masks since April 2020, using mask diplomacy and communication such as Taiwan can help, Taiwan is helping, but remember, in that difficult context that Taiwan is in. Here I'm just using a little bit of a broader context of the profile that Taiwan has had in the past year with COVID. We've seen the United States as well as the EU in different shapes and forms, of course, for different reasons, engage Taiwan. Both have different relationship with Taiwan, that is very clear. But here, what I want to show is that there have been initiatives to increase cooperation in spite of that isolation that I mentioned. So there's a joint statement on the partnership against coronavirus to cooperate on research and development between Taiwan and the US. On the European side, Taiwan's National Academy of Science, Academia Sinica, also organized a video conference with the head of the EU office here, and with the participation of DG for Research and Innovation from the Commission side in Brussels, and DG for Health and Food Safety. And then we've seen Malaysia's defense minister, for example, say that Taiwanese self-discipline was key to virus prevention success. And then another, of course, there's been many statements, but I thought this is just a good indication of the high profile. That Japan, the head of the Japan office Exchange Association here said that the world will remember the Taiwan of 2020. So I will try to explain why, in my view, why this is the case. Here, before I do that, I just have a tweet from the head of, or the president of the European Commission, Ursula von der Leyen, who thanked Taiwan for its donation of 5.6 million masks back in April last year, which was, again, very much appreciated and observed as something unprecedented, but definitely setting a precedent, in my view, for the future. Of course, the European Commission also issued a press release on Taiwan's aid to the EU, which was delivered to different member states. So moving on to the core of my presentation, well, the core of the Taiwan model, in my view, I picked three main acts, 3 T's, in fact, as in the letter T, meaning transparency, trust, and technology. And to each of these concepts, I associated further concepts that I think help us understand what the concept stands for. So in ensuring transparency, the government on a central level, but also on a local level, has shown a very honest attitude vis-a-vis the population, which helped build up trust and strengthen trust in the leadership, both on a local and central level. But here, I would pause for a second to say that trust in the case of Taiwan, and also in my experience of how I've seen it, is it's a two-way trust. On one hand is for the citizens to trust the government to do the right thing to protect them and their economy, but also for the government to trust the citizens to do the right thing. I will speak at length in a second about this. And then thirdly, technology and the use of digital means to make sure that the response to COVID-19 is sustainable in the country and there is accountability. These main elements have all helped and played a role in building up what we speak about today as in a Taiwan model. So it is a bottom-up, citizen-first approach with strong citizen participation and collaboration. The Central Epidemic Command Center was activated in January 2020 already, and this was with the aim to coordinate across government departments with daily news briefings that continue up to today, every day, with the Ministry of Health. This is the transparency element. And so the idea was to integrate the different actions at local government level. This is where the local government come into play and enable citizen participation. So to connect the district offices, the community healthcare centers, regional police stations to investigate the contact tracing. So it's sort of an effective and resilient division of labor. The proactive local government, which often was able to act better and faster than the central government. And another element is to fight mis and disinformation. And the infodemic that we've seen unfold beyond Taiwan, but Taiwan is very much used to the threat of disinformation. And to use humor over rumor, this is very much a Taiwan thing here, where the Ministry of Health used its own spokesdog to sort of ease public anxiety in daily messages coming out from the government towards society. And this is all to help build up that trust. And so here you can see the Ministry of Health of Taiwan has regularly put out messages as such with the spokesdog that has really helped to fight disinformation with humor over rumor, to remember to wash hands, to social distance and all those things. So this is just because it's funny. I wanted to be part of the presentation. So moving on to the technological aspect and the digital aspect of the Taiwan model, I would quote here the digital minister, Audrey Tang, the minister of Taiwan here, who in her own words said that she is working with the Taiwanese government, not for it. And I think this really helps us see this mentality and this relationship between society and the government to cooperate. And there's been many examples already before the COVID outbreak, where we've seen social innovation play an important role in engaging society to bring social innovation to help optimize government performance. And this is something that is another element that we can definitely learn from. And so this, while I said that the government played a role in strengthening the trust in the government, Minister Audrey Tang says that it's time that we radically, as in the government, radically trusts the citizens. So I think these are the two sides of the same coin when it comes to trust in Taiwan. We've seen a digital epidemic control, which has helped Taiwan also to step up when we've seen the surge in cases this May. For the first time, this was a situation that unfolded, but in 2 months' time, the number of daily cases was reduced from 3 to single digits. And I think we are still now in a few days row. I haven't watched the news today on this particularly, but in the past few days, we've seen 0 cases. And for to achieve this, we've seen this system, the contact tracing system 1922, this SMS system that allows citizens, whenever they go into shops or to do their daily business, to register, and this keeps track of their movements. But there is a careful way of management of the data, which is deleted after 28 days. So it's all about, as Audrey Tang says here in her tweets, is that data can only be appropriately used if it's appropriately sourced. And I think Taiwan has really shown how all of these things can be reconciled and not at the expense of privacy or security or the health of its citizens. So finally, lessons for the future, just to sum up, well, I think Taiwan as a model is something that we can learn from, but we can also, if for some people this is too much and too particular for Taiwan, because a lot of things can be done here but not elsewhere, then we should look at Taiwan as inspiration. This is something I strongly argue. We should look at their management in their citizen participation, social innovation, digital health and technology, and the role of cities, because they are at the front line of coping with the pandemic. And here, of course, we have the Sustainable Development Goal number 11, to make cities inclusive, safe, resilient, and sustainable. And this all played a role in Taiwan's success. So looking forward, it will be for the international community to find ways to include the Taiwan model and to be inspired by the Taiwan model, but it's also up to Taiwan itself to maintain the momentum, to build on it, and to navigate the diplomatic isolation. And finally, really finally, is I would use here member of the European Parliament, Reinhard Bütikofer's letter that he sent to Vice President Borrell, Josep Borrell, High Representative Josep Borrell, to ask for the EU's international partners together with the EU to push for a protocol that would allow Taiwan to be fully involved in the work of WHO in spite of this isolation. So there has to be pragmatic initiatives and workarounds to allow the exchange. And I think my time is up, so I will stop here. I apologize if I went a bit fast, but I wanted to include as much as possible in my presentation, and I'll be happy to take questions after. Thank you for your attention.
Yes, thank you, Julia. Thank you for excellent presentation. That was, very, very much illuminating in all the aspects. So thank you for that. Thank you also for perfect timekeeping. I would like to now move to another sort of high-tech regional entity. Let's be careful about that, how we define it. And I would ask Stefan Auer to talk about Hong Kong experience. Stefan is associate professor at the University of Hong Kong. He was twice named Jean Monnet Chair in EU Studies, first at La Trobe University in Melbourne in Australia, and then also in Hong Kong. He's written an award-winning book, Liberal Nationalism in Central Europe. He's published numerous articles in excellent journals such as Government and Opposition, International Affairs, Journal of Common Market Studies, West European Politics. And he's now working on another book about European disunion, democracy, sovereignty, and the politics of emergency. So as you can see, Stefan is more of an expert on the EU and Central Europe. But because of him being based in Hong Kong, I asked him to talk about his personal experience and possibly make some comparisons to Europe as well. So, Stefan, the virtual floor is yours.
Thank you, Tereza. It's an immense honor to be invited. Thank you for organizing this panel. I already found the first presentation fascinating, and I want to comment on that briefly. But I thought I would start by just making a very brief comparison with Europe, because as you said, I'm a European. I have actually studied European developments more closely. I experienced the Hong Kong developments. And it strikes me that at the very beginning of the pandemic, Hong Kong did exceptionally well, while Europe did exceptionally poorly. And I think that Europeans are still not fully aware of the fact just how abysmal the performance was. And I think there is a need for more awareness of that. Adam Tooze wrote recently that China, not just Hong Kong, China has done 150 times better than France when you look at the number of mortalities, right? So I think that in Europe, in the initial phase, the challenge was underestimated and the costs were immense. But right now, I am kind of envious of my colleagues and friends in Europe because I think that Hong Kong is becoming the victim of its own success, and the worry that we have here is that we will remain kind of isolated from the rest of the world for a long time to come, even though I still feel privileged to have lived through the pandemic here because it has been very much contained. We have not had any communal transmission for the last, for more than a month. The vaccination rates are pretty high. So let me say a few observations, a few words about the key to understanding of Hong Kong's success. I want to start by dispelling one myth that is pretty persistent in Europe, in the Western world, and that this part of the world succeeded because people here tend to be more obedient, right? There was a letter in the Financial Times that I felt I had to challenge, that praised this part of the world and the spirit of obedience that they helped them. I mean, for Hong Kong, that couldn't have been more wrong, right? Hong Kong was hit by the virus in the midst of massive social unrest. So far from obedient, people in Hong Kong were very much rebellious. And that takes me to one aspect where Hong Kong experience echoes what we just heard about Taiwan and being based at the special administrative region, not state, special administrative region, Hong Kong. I should probably not comment on Taiwan, but what Zsuzsa just talked about very much applies to Hong Kong too, and that is a very high level of societal trust that helped. But there is one aspect that was particularly useful in a way to the pandemic containment in the very early stage that I think also applies to Taiwan, and that is that trust, that societal trust that you experience within Hong Kong community. The other side of it is profound distrust of the communist authorities in mainland China. So at the very beginning of the outbreak, when the communist authorities in China were in denial about the severity of the challenge, the people here already mobilized. And this is one of the specific features that I find remarkable about Hong Kong, that it wasn't the government that triggered some kind of state of emergency. We just heard that in Taiwan, they recognized a danger on the 20th of January and established this Central Epidemic Command. That didn't quite happen here in that way. It was Hong Kong people who responded very quickly, very early on. And they masked up. They started wearing masks universally, and they stopped going out, basically, very commonly, very early on. In fact, it is quite ironic that when people started wearing masks here, it was illegal to wear masks, which was one of the aspects of the social unrest, that it was, the masks were oftentimes used in demonstrations to help people to maintain their anonymity from the surveillance cameras, etc. So it was actually illegal to wear masks, but everyone was wearing a mask to protect themselves and, more importantly, to protect the community. So early on, people understood the purpose of the masks, and early on, they used them. Another aspect that Hong Kong perhaps shares with Taiwan is that, owing to the experience of SARS, while people were distrustful of the government, there was a high degree of trust to experts and medical professionals, etc. And in fact, so the government then actually did its work too, but oftentimes in response to the pressure of the public or the professional groups. So, for example, one thing that I think mattered a great deal, and I'm surprised that Zsuzsa didn't mention it, and it's in stark contrast to what happened in Europe. I mean, in Europe to this day, I hear people saying that the virus knows no boundaries. I think that's a cliche that is terribly misguided, because an important part of the success in this region was that early on it was understood that you had to control the movement of people. And here it so happened that the medical professionals actually threatened strike and pressurized the government to massively constrain the movement between mainland China and then other parts of the world and Hong Kong. And I think that helped. So I think one of the unique features of the Hong Kong experience is that people recognize the severity of the challenge, and then the government followed with its policies. When it comes to vaccination, I think that on the whole, Hong Kong has done pretty well. So in terms of securing vaccines, Hong Kong is one of the few places where we actually had a choice between BioNTech and Sinovac vaccine. Where there were some deficiencies is mixed messaging around vaccines. So BioNTech, for example, obviously the German made Pfizer vaccine was here marketed alongside. There were mixed messages about the quality of that vaccine, right? In the initial phase, when vaccines were introduced, they were keen to stress the efficiency of the Sinovac, which is less efficient, but at the expense of Pfizer. So they damaged the credibility of that vaccine a bit. But in the meantime, we have more than 60% of people vaccinated. The problem is that elderly people are less willing to be vaccinated, and these are obviously the most vulnerable groups. But here too, I think Hong Kong is partly the victim of its own success, because however minuscule the risks are for people who get the vaccine, they are not completely negligible in comparison to the likelihood of you getting infected in a place like Hong Kong right now, because we just have no cases for longer than a month. So elderly who are anxious about being vaccinated, make their judgment that is the one that it is, and there is a problem. There is a problem there. Now, I just want to say a few words about the kind of broader political impact. And that, ironically, is something that I'm not meant to be discussing, because one of the recent political innovations here is the national security law that significantly constrains public discourse and media, etc. Right? So, and the very fact that this national security law was introduced was actually made easier. That law was easier to introduce because of the constraints that the government imposed on society for the pandemic prevention, right? So to this day, people are not allowed to gather in public in numbers higher than 4, which from terms of pandemic management, it seems completely nonsensical. Outdoor, and we are still obliged all to wear masks, whether it's outdoor or indoor. It's also the case that wherever you go, the streets are full of people. So you have always gatherings of hundreds of people everywhere. I mean, this is a very busy metropolis, right? But for political purposes, I think it served the government well. It has served the government well that it was able to just destroy any attempts at public mobilization of the kind of public protest that dominated kind of the headlines and the public life here, kind of a year, half a year prior to the outbreak, or a few months prior to the outbreak of the pandemic. So the social protest, the kind of social disruption that was caused by these mass protests was squashed much more easily through the measures that seem to have made sense, particularly initially, in terms of pandemic prevention. I don't know how they will. We have no sense as to when, how, and whether some of those restrictions will be lifted. How much longer do we need to have the situation where there are no community transmissions for the government to relax some of those rules? It is not clear to me. But as I said at the opening, and I'll probably leave it at that, on the whole, it has to be said that Hong Kong has done remarkably well. We never had the kind of hard lockdown that countries across the world, in Europe, in Australia, of course, experienced. The schools were closed for a long period of time. There were some restrictions on people working at their workplaces. But on the whole, the city continued to work, and most people continued having normal lives. The only severe restriction that we still have is the freedom to travel. So there are very strict quarantine rules, which initially helped, and I think were very sensible, but increasingly I think Hong Kong should now start learning from Europe and other places in the world how to reopen itself towards the outside world. But it's not going to happen anytime soon. Thank you.
Thank you, Stefan, for sort of, making some comparisons and contrasts to Taiwan, and also bringing up, the local, the grassroots movement at the beginning, which I'm not too sure how many people are even aware of that. I would like to now move on to another country, to Malaysia, which is probably slightly different case than the first two that we heard. Taiwan and Hong Kong. So I would like to ask Dr. Chiew-Ping to join us. Just a few words about her. She is a senior lecturer in the Strategic Studies and International Relations at National University of Malaysia. She was also Shangri-La Dialogue's young leader, and also, if I remember correctly, Ministry of Unification emerging leader. Together, we've done the program together. She was also Korea Foundation Field Research Fellow at Seoul National University in 2010, which I also have very fond memories of a few years after that. Her interests lay not just in her homeland and Southeast Asia in general, but also in the Korean Peninsula, primarily the North Korea relations with Southeast Asia. So she's an expert on Korea as well. She has consulted international Malaysian press in various languages, including BBC News, Wall Street Journal, Washington Post, South China Morning Post, and others. So she also has not just the academic background, but also a little bit of more public policy or in that area. So thank you very much, Chiew-Ping, for joining us. And I would ask you to take the floor. Thank you.
Thank you so much, Tereza, for inviting me to join this forum. So what I'm going to share hopefully would tie to not only this panel, but also to the second session later as well. So on the COVID-19 measures in Southeast Asia, we can look at it from the regional perspective, which is relying on the ASEAN as the regional mechanism. So I look forward to have this contrast and comparison with the European Commission later. At the regional level, the first response was jointly done together with the +3. So ASEAN +3 consists of the 10 Southeast Asian countries and China, Japan, and Korea. So in the meeting convened from late March and later it was announced in mid-April last year, they set up the COVID-19 response funds, and ASEAN +3 also coming together to come up with the comprehensive recovery framework and the joint study on 10+3 cooperation to improve supply chain connectivity was also being launched last year. So as has been mentioned by Dr. Sousa Ferenczi just now, that the supply chain is one of the core concerns, especially in the Indo-Pacific region. So in this regard, to enhance supply chain and also other initiative that was launched by in between China, Japan, and Korea towards ASEAN is actually about ASEAN food security and emergency rice reserve. At the beginning of the outbreak, when borders starts to close down, there were news about how Thailand is going to restrict its rice export, and Vietnam start to freak out, and the many other rice consuming countries, including in Northeast Asia. So that is why the Northeast Asian countries promptly set up this kind of food security response to the pandemic. So coming back to each of the individual countries in Southeast Asia, I'm not going to compare all 10 of them, don't worry. So in terms of the public response, many of the governments centralize a lot of their response, and therefore they are exhausted and also overwhelmed by the COVID-19 impact. So in this regard, Brunei is an outlier because it managed to keep the number very, very low until now. No domestic transmission. So as the Sultanate Kingdom, so it managed its border with Malaysia with a set of very specific agreement that we had since mid-2000s. A lot of my hometown friends in East Malaysia were trapped in Brunei and unable to visit their family until they are being vaccinated. So I myself couldn't go back to my hometown because my home state imposed a different sets of rules than the federal government. So it depends on the makeup of our federal, central, and regional governments. So there seems to be misinterpretation, confusion, too many rules. So unlike Taiwan, in which they have local government that respond faster than the central government. So in this regard, only my home state has done so, but not the other states in Malaysia. So there is also a strong drive for rapid digitalization. So luckily, because of how integrated the economic and trade between ASEAN and the +3, namely China, Japan, and Korea. So we have actually transformed the existing digital framework that was already being transferred by those countries. For example, China's Alipay, Japan's Line Pay, and also Korea's digital banking practices has been localized in each of the Southeast Asian countries' practices. So, and all of this actually require private sector's support. So I think in this regard, we are not as synergized or integrated as a South Korean case where public-private collaboration is very neatly done. So in which our friend Jun Park would present in the second session, whereas in Southeast Asian countries, it really has to depend on the small and medium enterprise to bring their innovation and to grab government's attention that what they have come up with is actually applicable and usable and useful to face the pandemic. So for the bottom-up approach, yes, we do have that. Actually, people are taking care of the people where especially when the government is not able to do so when they are being overwhelmed. So we see many civil societies, people organizing themselves into group according to community and to fund pooling and to expand our diverse fintech capacity. So all of this, hopefully in the future, government would adopt stronger approach in incorporating civil organizations into government planning. In terms of vaccination, there is a high level of acceptance. Vaccine disinformation and misinformation also exist in the form of social media. So again, the people or the civil society group has to mobilize their channels to ensure the people that vaccines can be trusted. Unlike European countries, we quite diverse in our embrace and acceptance. So we accept Sinovac, CoronaVac, and also Pfizer, Moderna, Johnson & Johnson, and a wide range of many other like AstraZeneca and so on. So in Malaysia, we have at least 5 or 6 types of vaccine available for vaccination. So we are now going to reach about 80% of complete vaccination among our population, including foreign citizens in our country. So this, the lesson is that this pandemic awakened the Southeast Asian countries of the importance of managing migration. So foreign laborers, especially those of blue collars working in construction and other areas where local citizen doesn't want to work in. So we, in the health ministry's planning to vaccinate all of them, they realized that the number is so much higher than the earlier anticipated. So there is a need to treat the migrant workers better. So we hope the human rights record can be improved. That is my wishful thinking, but I hope it can be realized. And one of the aspects that Professor Stefan Auer has also mentioned is the political implication. So as the pandemic erupted, some of the countries here are facing political instability. So some of the groups or coalition actually seize the opportunity to legitimize their rule. So that include the Myanmar military coup. So this has been perpetuate the political instability in the region and unable to have us to work better on the collective resilience against the pandemic. So I actually hope that we can actually absorb some of the mutual lessons here. Positively, we trust science-based policy making. We also trust the experts. But negative sides, we have low number of science literate policymakers and politicians, and this is why at the first place misinformation spread widely. So we also in need for a public health infrastructure in the region. So ASEAN has a very diverse capacity in health. So we look forward to how other region is doing this. For example, from Europe, you have a Shenzhen area. So in terms of traveling, how do you manage that? We are now very careful in opening up. So later, my friend Dr. Erwin Tan would share the Singapore example. We are trapped in this contradiction of wanting to open up to help ourselves economically, but also afraid that our health infrastructure will collapse due to the opening. So vaccine equity is something that we wish to have more of global cooperation. But so far, as we can see in the case of Europe, the vaccine exclusivity require people like me who receive a Sinovac revaccination if I am to enter Europe again. So COVAX also falls short of expectation, in which we have Indo-Pacific Alliance that prioritize European and American vaccination. BRI, China's Health Silk Road initiative, and then there is Quad, and then there is more different regional collective purposes. And this, of course, would affect other regimes that we try to extend humanitarian assistance, such as North Korea. So I think vaccine equity would be a long reach given the situation that we are in now. So I hope the economy questions, the climate question, how we manage our environment, by now we all realize that none of them can be separated and can be take care exclusively. One is linked to another. So I really hope that with this kind of track 2 exchanges, we can discuss more about establishing linkages and how to better streamline our supply chain and many other industries. So thank you so much.
Yes, thank you very much, Chiew-Ping, especially for bringing up not only experience from different corner of Asia, but also a bit more of the political consequences for the whole region, for your homeland, but also for the whole region. I would now like to give a floor to Anselm Kanwischer, who is based in another country in Southeast Asia, that is in Cambodia, and he will give us his views on how the situation looks in there. He also has slightly different perspective because he is a practitioner of in the field of international cooperation and member of different organizations and movements working in the area of peace building and human rights. He has worked in different countries and on different scenarios, and moved at the end of 2019 to Battambang-Cambodia, and he could observe and experience the pandemic and all the pandemic measures and the impacts on the ground since the very start. Anselm will be speaking in his personal capacity, despite the fact that he works for here in Germany, or German organization. In any case, I very much look forward to hearing your views from Cambodia. So please, Anselm, the virtual floor is yours now.
Thank you very much, Tereza, and thank you very much, everyone. Yeah, I am very grateful that I can be in this exchange possibility because, as you said, I speak for myself, not for the organization or for Cambodians. But I obviously exchange a lot with Cambodian friends and colleagues, and so I hope my experience and observations will be a good exchange here, because I do believe as well that exchanging is, as it is an epidemic and we have the possibility to exchange now online, one of the keys to overcome struggles with it. And I will explain a bit on the situation, which from my view is as well a bit special as are others, but the Cambodian situation has its specialties, and on the measures taken, on the vaccination situation, and on the impacts the pandemic and the measures have caused. And even though it is probably too early for clear lessons learned, I think there are some observations which I want to share. So why do I believe that the Cambodian situation is special? Until February 2021, there was almost no recorded cases in Cambodia. And there are as well different explanations why this has happened. So there is the explanation, for example, that the population is really young and that might have not been registered so quickly, but as well a lot of interacting is happening outside, and as well compared to other places, for example, for greeting someone, it is a scenario where a virus might not spread so easily. But other people as well say that there was not much testing, so there was maybe not so much discovery at first. But even though only in February this year, the situation changed regarding the numbers. Last year already quite many measures were taken. And the thing is that here in Cambodia, most measures have some basis from the national government, but are implemented then regionally differently. And for example, there was only a short time a travel ban, which was implemented for the whole country, but then there were different other lockdowns or semi-lockdowns, which were for cities, for example, like the capital, Phnom Penh, where there was even inside the capital, there were different zones, which from my perspective is a good approach. So where there are more possibility of transmission, that the measures were more strict handled than in other parts of the city or the regions. And other measures included quarantine for everyone who wants to come to Cambodia. So since March last year, it's a 2-week quarantine, and that was partly as well handled differently until this year. So there was a home quarantine, and now it's a mandatory hotel quarantine. But there are different ways of implementing that. And as well, here we have the situation. I'm living close to the Thai border, so there are many migrant workers, Cambodians who used to work in Thailand, and due to the economic situation coming back to Cambodia, because they struggled, and then they were brought in quarantine centers, which at the beginning, from my perspective, what I heard was a bit messy. From what I heard now is that this is better organized, and as well the human living conditions are better than they were at the beginning. Yes, and what has changed in February 2021 is that there was the first community outbreak recorded, and there are as well different rumors or different narratives how it could come to that outbreak. So some people say it was brought from outside, and then the quarantine measures were not accepted. Sorry. And some people say that had maybe even to do with the situation in Myanmar, so that measures were justified easier in this respect. But some people as well say that it was always there, or it came slightly through borders. So there are many different scenarios which could be the case. But since then, around 100,000 cases were recorded, and around 2,000 deaths were connected as COVID deaths in the statistics. And of course, since then, the testing increased as well a lot, which was not so much before. So based on these higher numbers, the measures as well strengthened. So the quarantine, as I said, was more strictly implemented. There were curfews in some cities. There's an alcohol ban pretty much since April, but it is the possibility for the different regional scenarios where there are more cases detected, the measures are usually more strong, and regions which have less cases have the possibility to have less strong measures implemented, which I think is a good approach. Then regarding digital possibilities, there was a track and trace per app or per registration implemented so that everyone who would go to facilities could register there, so that if there would be at some point, let's say a bank, a place where there was a case detected, that through that track and trace, other people could be informed and accordingly measures could be taken. Since around the change of the year, the vaccination started here as well. And I think this is as well for a country which does not have huge financial resources, quite interesting that Cambodia managed very well to get vaccination. And I think there are different opinions whether the vaccination is the cure for the pandemic or not. But if you believe that it is the cure, then that was managed really well. In regards to availability of vaccinations, some people already have their third shots, booster shots, and this is something which hopefully will give the possibility as well for the country to opening up, because the impact that not only the virus but as well the measures had on Cambodia were really strong from my perspective, and the impact not only from the measures in Cambodia but as well from measures of other countries, because Cambodia depends a lot, for example, on export. And so, for example, the garment sector suffered a lot. There were less contracts, so people were laid off. And as well in the garment industry, people work very close together. So this is as well something which on regional level was difficult to manage. And on international level, the contracts were gone partly, and as well, for example, the rice export was not so easy. So there are different things where especially the weakest in the society, the economically weakest, really suffered from economically the situation deteriorating, and as well with many households being already in debt, paying back debts was not so easy anymore, which led to even some people having to sell land. And I'm not talking about huge quantities of land, but the little land, they grew the rice and they couldn't pay back debts and they had to sell this land. So this is quite a strong impact, which is still happening. And economically wise as well, the tourism sector, which depending on which statistics makes 1/5 to 1/3 of the GDP, broke down with March last year, the pandemic being officially announced. So many people who lived and worked in the tourism sector lost their income. Often they supported other family members from this international money coming in pretty much. That was lost as well. So this is as well a strong impact regarding worldwide situation and local measures. Since the quarantine is in place and no tourist visas are issued up to date, no tourists are practically coming, and we hope this will change, but we will see about this. Another huge impact from my perspective is that schools are practically closed down since March last year. And there were some times in between when they could open quickly and then were shut down again. And now they are slowly reopening, which is as well according to the vaccination situation, something which is now permitted, which I think is very good, because this only the lessons we learn from that will probably take 10, 20 years. But I believe that this has as well a strong impact, as, for example, as well the art scene and the sports scene pretty much had to pause for some time or for a long time, depending on the distancing and traveling regulations and things like that. So there is a lot which had led to people being devastated here, and not at least as well the mental and physical situation. For one part, of course, because of the virus, but as well because of the measures of people not being able to do physical workout, for example, or as well people not being able to group together, and the fear which is spread by the international media and local media, of course, in the same boat. So this is something where there were definitely strong impacts from the pandemic and the measures, and that's as well from my lessons learned. I think what I would share as well as from my peace building background, I think being cautious is always advised to everyone regarding the virus as well as regarding the measures, and being creative with it, not being too strong about it when there are different views from different people regarding the virus and the measures. So I think the solidarity which is needed, and that's why I'm very grateful that we can share observations and not only listen to some few people talking, but as well then have a Q&A. So I think it's a good format that we can exchange on observations, and obviously not everyone will be of my opinion and I will not speak for someone else, but we can see how we can handle this situation together in solidarity. So this is my conf, and Akun Charan is as Cambodian for thank you very much.
Thank you very much, Anselm. Thank you for your observations. I also have, good memories of visiting Cambodia just a few months before the pandemic started. And obviously, it's very good that you also brought up, the impacts on the most vulnerable populations, those who are most in need, not just in terms of the pandemic, but also, economic need. So now, last but not least, I would like to move back to Europe, so to speak, and I am really happy that I could welcome here on the panel Dr. Americo Zampetti, who is joining us from Brussels, from the European Commission. Rico was educated at University of Rome and Johns Hopkins Universität in the United States. He also received his PhD from KU Leuven, was visiting scholar at Harvard Kennedy School of Government, but he has really the practitioner's background in addition to his academic achievements. He worked for the Italian Trade Commission, OECD, UN Secretariat in New York. He was also head of the economic section of the EU delegation to the United Nations in New York from 2010 to 2015. And he is currently advisor at the European Commission's Directorate General for Health and Food Safety. So this is really the key Commission's DG, which is in charge of the pandemic response. So I'm extremely happy that Rico has found time to join us and to share the European experiences, but also perhaps a little bit react to what everyone said about the experiences in Asia. So thank you, and please, Rico, give us your insights.
Thank you very much, and thank you for the invitation and for the very discussion morning or afternoon. I'd like to give you a little bit of the perspective from the European Union, how we have been handling crisis and what are the main sort of silver lining, if anything, from the crisis. So let's start. So the global pandemic, of course, has shown us that we need to be better prepared for cross-border health threats and able to respond adequately to them. Fighting the pandemic, we have learned that working together offers the best and indeed, from our perspective, the only chance at securing a healthier future, both for people and for the planet. Cooperation and solidarity really are the only viable way forward. To see how cooperation can be the most effective solution to global problems, we need to look no further than the remarkable way in which the world scientists have come together to deliver safe and effective vaccines. Similarly, the EU vaccination strategy has shown the power of European cooperation and solidarity. The EU has worked hard to ensure that vaccines are produced and delivered as quickly and as safely as possible. Working with our member state, we have obtained a diverse but common portfolio of vaccines. And we have done all we can to give member states equal access to the available doses and at the same time for everybody. So our work, despite the difficulties at the beginning, has paid off. We have met our target announced in the summer of fully vaccinating 70% of the European adults, which is now being achieved. But vaccinating at home, of course, is not enough. This is why universal and fair access to COVID-19 vaccine and treatment is both a top policy priority as well as clearly a moral imperative. The EU, since the beginning of the response to the COVID pandemic, has chosen to accompany its internal response with a very robust multilaterally based strategy committed to the principle of universal, equitable, and affordable access to COVID-19 vaccines. In response to the WHO's call for global action, the Commission launched a global coronavirus response to mobilize resources and join forces among countries and global health organizations to accelerate the development and deployment of diagnostics, therapeutics, and vaccines wherever they are needed. By the end of May 2020, the pledging campaign the Commission initiated raised about 10 billion euro, to which we contributed 1.4 billion, with the aim, of course, of providing universal access to affordable vaccine treatment and testing. So far, the EU and its member states, including our financial institution, working together as Team Europe, have mobilized over 40 billion to support partner countries' effort to fight the pandemic. The EU has also been exporting around half of its vaccine production. In all, we have sent more than 800 million doses to over 130 countries. So we have essentially exported more vaccine than the one that has been distributed within the European Union, which amounts currently to around 700 billion doses. We have also helped spearhead the global vaccine rollout with over 3 billion in support for the COVAX initiative to ensure equitable vaccine access. Team Europe has already committed to donating 300 million doses by the end of this year. And in a recent State of the European Union address, Commission President von der Leyen pledged a further 200 million doses by the middle of 2022. COVAX has had a difficult start, but it is now beginning to deliver important results. For instance, to date, Asia and the Pacific received approximately 140 million doses through COVAX, which represents almost half of all doses delivered by the multilateral platform. So the EU is doing its share for global cooperation and solidarity. Of course, vaccination is not enough. We also need to protect and improve healthcare systems, which have been and continue to be under enormous stress in many countries. Looking ahead, we have to make sure that the World Health Organization can play its critical lead role in making the world safer against future pandemics. This will take time, but if we use the current political momentum, we can move forward. We believe international cooperation can be significantly enhanced through a binding international agreement on pandemics under the WHO roof. This agreement would have an important role to play in combating serious cross-border threat to health at national, regional, and international level, and can move all of us toward a more robust global health architecture. Among other things, the agreement can promote better national, regional, and international preparedness and response, stronger health system, and offer predictable funding, especially for lower middle-income countries, along with technical assistance and capacity building. Looking inside the Union, we are taking important step of reform. In particular, we are working hard to build a strong European health union. We want to press ahead with 3 key proposals designed to strengthen the European Medicine Agency, to give the European Centre for Disease Prevention and Control a broader mandate, and address serious cross-border health threat within the Union. We are also setting up a new European Health Emergency Preparedness and Response Authority the acronym is HERA. This will be another vital element in our health union. Learning from the gaps that the pandemic has revealed, HERA will help anticipate serious cross-border threat and identify effective responses. This will enable the EU and its member states to rapidly deploy the most advanced medical countermeasures in the event of a health emergency. In conclusion, we are turning the tide against COVID-19, and we are also learning vital lessons as we go forward. We believe this will ultimately help us in our ongoing effort to build cooperation and solidarity in the service of global health and, of course, broader development around the world. Thanks.
Thank you very much, Rico, especially for bringing up sort of the latest efforts in terms of vaccinations, not just at home, but also abroad, and for some lessons learned from the pandemic on the European side. I would like to thank all the speakers now for their presentations. So I would like to ask anyone who has been listening to us, if you would like to ask questions, please do so. I would like to ask some questions perhaps first, and maybe I'll try to go, maybe not one by one, but sort of a little bit in the reverse order. So maybe I would start with Rico first. When you focused mostly on the EU's vaccine campaign, which perhaps at the beginning had a little bit of a bumpy start, but now it's going quite well. But what do you think are the most, the lessons Europeans should learn from the very early stages of the pandemic? If I think back about, very chaotic situation in 2020 when countries didn't really know what to do. There was a lack of masks and all sorts of other PPE. The countries were shutting borders. It looked like, that the Schengen Agreement on freedom of movement between the European states is kind of over. Of course, the European Commission doesn't have, as many competencies in the areas of health as in other areas. And so obviously it's not just up to the European Commission to learn. But nevertheless, what do you think Europeans as such should take from the first stages, especially since what we've listened about the Asian experiences? That for perhaps countries like Taiwan and Hong Kong reacted very promptly and quite precisely, and we will have panels discussing Korean cases, and they, Korea is also one of the examples where the reaction was pretty fast and quite effective. So what do you think is more the lessons from the first half, let's say, of the pandemic?
Well, look, we have to acknowledge that when we refer to this crisis as unprecedented, is really what it was. It was unprecedented as a health crisis, and found most of the countries, if not all countries, rather ill-prepared to respond. Now, some fared well at the beginning, then didn't support that good record. Some started a little bit with greater difficulties and then caught up and actually delivered on the promises made. So it's a difficult situation overall for all countries. I think in the case of the European Union, of course, responding to crisis has always the added difficulties that you have to bring everybody on board in a community of 27 member states. I think the depth of the crisis has shown that European coordination is precious, and I think that lesson has been learned, and hence the move to reinforce the European Health Union and the establishment of HERA and the joint procurement of vaccines and the joint response in terms of international solidarity. Overall, the lesson, I think, is that faced by extremely difficult situation, you're better off working together within the union than working as an individual country. Thanks.
Right. Thank you. Well, fingers crossed that it's not just the European Commission which thinks so, but also the individual member states. And let's see how the proposals of establishing sort of HERA and strengthening its ECDC, so to speak, in the direction of what we've seen in the North Asian countries, how that would work. Maybe I'll move to our guest from Southeast Asia. Especially, Rico mentioned European efforts to fund COVAX, which is the multilateral, multinational system to provide vaccines, especially to lower and middle-income countries. I was wondering, do you know much about how that has been used either in the country of your interest or perhaps even in the neighboring countries, how it has been perceived? Has it been effective, or is it more, in terms of like promises which haven't materialized yet? And how does it all fit within, also the other countries which are trying to suddenly provide vaccines to the region? China on one hand, but the United States is also now quite keen on, being seen as the big vaccine provider. Do you maybe just share some thoughts on that? Thank you.
Okay, so I will just quickly say that so the one that set up COVAX is Gavi, the Global Alliance on Vaccine. So they try to ensure vaccine equity, so which is a big problem right now. So for example, United Kingdom has pledged about £2 million worth of AstraZeneca to North Korea. And everyone designates part of their budgets for the global commons good. So in this regard, the major powers and especially the advanced and developed countries should play a part in trying to take this global alliance movement forward. Unfortunately, because of some dispute over so Chinese vaccine is not donated, so they are being sold. So a lot of kind of like the BRI debt trap diplomacy theory. So likewise, their vaccine diplomacy was being seen as a form of debt trap diplomacy. But in reality, it has to be dependent on how the individual government negotiated with China as the Sinovac and CoronaVac provider. So on the other hand, we have AstraZeneca initially being banned by some of the countries for its problematic side effects among the population. So Pfizer, Moderna has been recognized as some of the safest vaccine, but also among not that among the most expensive as well. So we see that manufacturing capacity of the vaccine is now at the core. So International Vaccine Institute should also coordinate with WHO and in conjunction with the Gavi COVAX Alliance have to know which countries are best to have the capacity to set up factories and to also laboratory to produce those vaccines, and therefore each country can devote more of their quota to how much they can contribute, and that would enhance global resilience against the current pandemic and also in terms of the next stage of the research for future pandemic. So the occurrence of pandemic has been cut short. So since SARS, for instance, we have seen MERS, other types of flus. So right now, the year has been cut, like every 10 years become every 8 years, 5 years. So now we don't know whether the next pandemic will come in 3 years' time. So we always have to prepare for that according to the reliable scientific research that we now know of. So that's all I can share about COVAX. Thank you.
Thank you very much. Yes, my question was if you would like to also comment on this, Anselm, or also on the fact since you work for a non-governmental organization, how, not just the official European contribution through the COVAX or through the European Commission work, but also, how perhaps the NGOs on the ground are, working or helping local populations, or if there could be, more work done. And perhaps how does it fit also with all the other international partners?
Yes, thank you very much. Yeah, I need to say from a Cambodian perspective and very much from my observation, the vaccine diplomacy, as was said very well, was played here very well by China. So the huge quantities of vaccination in Cambodia come from China. And from the EU, there was little, and it is seen that there are efforts, but in comparison, this is very little. And it was as well seen, and this is as well my observation, not only from others, that countries, member states of the European Union, but as well other North American countries have to destroy vaccinations instead of giving it to elderly or vulnerable population in the southern hemisphere. So I think there's as well, it's good that solidarity is an issue, but how far it goes is as well something which can probably be discussed in this respect. And there's a Cambodian perspective is that the EU is seen more critically.
Yes, and in terms of all the sort of non-governmental efforts, were there any European NGOs trying to help on the ground? Of course, your institution, but others perhaps too.
Well, I mean, we are, as an organization, working on making people, raise their concerns in a nonviolent way, of course, and so that things are discussed and that concerns are raised, I think, is something many NGOs are working on. But as well, the environment here is not always easy for this. And then the geopolitical interests of not only China, but as well as the US and the EU, then as well put pressure on various actors. And we are a non-governmental organization, and there are other non-governmental organizations, but state actors as non-governmental organizations as well feel pressure from very different sides in this respect. So it is a politicum as well, the whole vaccination diplomacy.
Yes, thank you. I would now ask more questions to our two guests from Northeast Asia. I have one specific one for Stefan, whether you believe that Beijing has actually told Hong Kong what it actually needs to accomplish in order to reopen Hong Kong's mainland China border. But perhaps I could also sort of expand it, because I think both you and Julia, but others as well, you are talking about, closing borders and different quarantine systems. So I would be quite interested in your sort of views, because obviously, if I compare it with the situation in Europe, at one point Europe closed its external borders, but also some of the member states were closing its internal borders. There were different rules, how and when you can go from one country to the other, until basically 1st July this year, when, I think all of the member states introduced the EU COVID certificate. So that's an effort from the European Commission to basically allow the movement of people again across the borders, either with testing or vaccinations or proof of recovery from COVID-19. So, what was your experience, both in terms of external borders and perhaps the internal borders, if there are any in your respective regions? So maybe I'll start with Stefan first.
Thanks, Tereza. So there was a recent meeting in the local administration met officials in mainland China just a couple of days ago, and it seems to be the case that the focus is very much on opening the borders to mainland China, and that the targets that Hong Kong is meant to achieve it's a moving target, and no one quite knows what the target is. So it seems unachievable. But I can't help myself and raising a question in response to Americo's presentation. I suppose I shouldn't be surprised that Americo kind of represented the position of the Commission. But I was surprised to see Ursula von der Leyen making it the centerpiece of the State of the Union address, to present the whole pandemic management as a success story. I find that completely alienating. Watching it from Hong Kong, Europe would have helped places like Hong Kong. Europe would have helped the whole world early on if it managed its pandemic domestically. It massively underestimated it. And I'm aware of the fact that the EU has no competencies in health. But as late as February 26, the Commission confidently stated that Europe is well prepared, that the risk is low to moderate. So Europeans should have had expertise and should have watched what is happening outside of Europe, including in Hong Kong, including in China. And so I have no confidence that Europeans will learn any lessons when there is no willingness to even contemplate that some mistakes were made. Now, the focus is, of course, on vaccines, because it is true that Europe seems to have turned a corner right now. But even there, the track record is much more mixed. I mean, first, the purchasing vaccination strategy, I don't think worked as well as it could have worked, even if it was left in the hands of Germans, Italians, and a number of countries that pursued that policy early on. But the Europeans caused damage that goes way beyond European borders by rubbishing AstraZeneca, which is at the center of many people's hopes still today. So my friends in Australia are reluctant to take AstraZeneca because European politicians, for political purposes, early on rubbished that vaccine, right? That has massive consequences. And so I find it deeply disappointing that Europeans are not willing to even talk about possible failures. I mean, if we are not willing to talk about such failures in this kind of limited forum, then what hope is there that any lessons will be learned? What I see is this kind of patronizing attitude that actually dominated the European discourse early on. So rather than Europeans looking at places like Taiwan, looking at places like Hong Kong, that were already taking effective steps to contain the pandemic, were, going on as if nothing happened and assuring themselves that they were well prepared. And you mentioned, Tereza, the question of borders. I think it was absolutely vital to constrain the freedom of movement. I mean, in Europe, there was an absurd situation early on in Italy, right? That the city of Milan was basically in a lockdown while thousands of people were flying out of Milan to Berlin, to Dublin, to London, spreading the disease across Europe and across the rest of the world. So in this part of the world, very soon after the outbreak of pandemic in Wuhan, the most sources of the pandemic came from Europe and the United States. And so not to acknowledge any of these mistakes and shortcomings, I find deeply disappointing, I have to say, as a student of European politics and as a European, I find deeply disappointing.
Thank you, Stefan, for voicing such a strong criticism. I hope that this discussion actually is contributing to maybe also to us Europeans to learn a little bit more from the experiences that you share with us and other speakers on this panel. I think Europe definitely needs to learn a little bit more strongly from both its mistakes but also from the good examples abroad. I have one question about the role of geopolitics in enhancing and restricting access to vaccines in Asia and what Asian economies learn from this experience. And I would also like to ask a little bit more about the digitalization of the pandemic, because that was also one of the points where Europe was at the beginning very hesitant, saying that lots of the apps that have been used throughout Asia, that something like that would not be possible in Europe because of infringement of data privacy. And yet what we've heard is that actually digitalization was one of the key tools and was done in a very transparent manner. So maybe if you can combine these two questions, one would be lesson from sort of digital health, so to speak, and the other one would be more about the geopolitics and economics of the pandemic and the impact and lessons for those two. I haven't given a word to Zsuzsa yet, so let's give her floor first, and then I'll move to other speakers. Thank you.
Thanks, Tereza. Well, there's so much to say, but first I just want to also echo Stefan's doubts when it comes to the European response looking forward, whether we've learned lessons. I do share the disappointment that there was very little acknowledgement of where we went wrong, and that probably damages how open we can be to learning from other good examples. So I do share that with Stefan, but maybe I'm slightly more hopeful because we have to remember that it's not just the government that is in this whole picture, right? The government is responsible for a response to protect the health of the citizens, of the economy. But I think what citizens can learn, I mean, maybe I say that it's easier for me to say that because I'm in Taiwan and you might share the same experience. But from my perspective, maybe because I experience a good example, and I also experience the bad example in Europe, I can recognize the importance of not just the responsibility of the government, but the participation and the collaboration that comes from citizens. And as I said that earlier, it's not enough to recognize the importance of that. The question is, how do we actually get that? How do we get more participation? So I think that's more the debate to have. Maybe we need to shift a little bit also the communication and to come up with ways that actually bring more citizen participation in some shape or form. I'm just putting this out there. I don't have the strategy going forward, but I do believe, and I can be in a way hopeful, that because it's been such a terrible experience in the European context, I do feel that there will be lessons learned also coming bottom up, not just top down. But at the same time, looking at the Commission and listening to the big plans of the European Health Union and all of those big visions that really require member states' support and cooperation in an area where member states remain in control of their national policies when it comes to health. Again, I am doubtful. So I go in between doubt and hopeful. And to stay on the hopeful part, because I'm in Taiwan and I do see interest in opening up to learning more from Taiwan, and I see that we've seen that more in Central Eastern European countries, I strongly believe that will pay off. So it will not just be a sign of solidarity that Slovakia just sent 160,000 vaccines. I believe that this will translate into something more, that people will understand more about Taiwan, and they will want to learn about Taiwan and the Taiwanese experience in a successful management of pandemics. So yeah, this is some of the things I wanted to say, and also concerning the borders and you earlier touched upon. Yes, indeed, in the case of Taiwan, this was crucial that already in January, or maybe I'm mistaken, January or February, but immediately flights were stopped coming into Taiwan from Wuhan, and then the borders remained closed up to today for non-essential travel, and quarantine is extremely strict. I just went through it myself, and it is what it is. It's a price to pay, but the question is, as Stefan, you asked earlier, how do we reopen? How does Taiwan reopen to the world? Again, it brings back the question of isolation and diplomatic isolation and the geopolitics of Taiwan's situation. But it's closely linked in terms of science and technical aspect. It's closely linked to vaccines and the level of reaching a safer level of immunization within society, which Taiwan has not done as well as the other examples that we've heard of. I think this is going to pick up in the coming weeks because we're reaching the moment where the second dose is coming up for a lot of people who received their first dose, but Taiwan had difficulties getting the vaccines. There was also the hesitation. There was the miscommunication of AstraZeneca and the whole mistrust surrounding AstraZeneca. So a lot of factors play a role in how Taiwan goes forward. But I strongly believe that times are different when it comes to how we see Taiwan in Europe. I don't mean to overplay or overestimate what is happening in EU-Taiwan relations, but I do strongly believe that there is a shift. We see that mostly shaped by, again, Central Eastern European countries who are more willing to speak up. And I think that will bring with itself also this cooperation and exchange in health. So for the future, yes, there's doubt, but there's hope also as far as I'm concerned. So maybe I'll stop there because we're running out of time.
Yes, well, thank you very much, Isa, for being both critical but also hopeful and positive for the future. I think I have to give time to Rico to properly respond to all sorts of points raised. And yes, unfortunately, the time is coming to an end. So I will first give a chance to Rico to respond, but also maybe to have some concluding words. And I would probably like us to all focus on really the biggest lesson, either from your specific region or what you think would be the globally the biggest lesson, the most important lesson for the future, how to prevent any future pandemic, how to, or at least if they are there, how to mitigate them. So first, if I may, Rico, if you could say a few words. Thank you.
Yes, no, thank you very much. Very briefly, of course, there were a lot of mistakes, a lot of difficulties at the beginning. There is no denying of that. I'm not sure anybody has ever denied that there were serious problems at the beginning of the response to the crisis. I think Europe and the European Union institution managed nonetheless to find an effective path out of the crisis, and they did so by increasing their cooperation. We have to remember that there were serious, and there are still serious, supply chain constraints in terms of the delivery of vaccine. 2 out of the 4 main vaccine manufacturers that deliver vaccine to the European Union grossly undersupplying the European Union. AstraZeneca had to be brought to court, and he lost the court case because of its breach of contract. And Janssen has very serious supply problem, as you have read in the paper, in terms of their plant in the United States, which have reverberated in an extremely significant undersupply of the European market. So that all to say that with this set of challenges, nonetheless, by working together, we have managed to reach a 70% of vaccination coverage, which I think is a good result. And it does also underscore the importance of keeping on the path of closer cooperation within Europe, as well as the path of remaining open to the rest of the world. As I noted, the European Union has exported more vaccine than it has distributed domestically. He has exported around 800 million vaccine, and he has distributed domestically 700 million vaccines to date. So Europe has remained very much open to the rest of the world providing vaccine, and it has also been one of the main forces in setting up the multilateral response. So altogether, I think, of course, is a mixed bag. There were many difficulties, many mistakes, but I think the way forward is once more the one of increasing cooperation both within Europe and globally. Thanks.
Thank you for both acknowledging mistakes and being sort of positive in terms of further cooperation internally in the EU and for the world. Maybe now, Anselm, if you would like to also have some final remarks.
Thank you very much. Yeah, I liked what Susa said regarding the participation. I think this is the key, that we don't talk only about measures and about vaccination numbers, but that we talk about threats of viruses, that we talk about risks and benefits of vaccinations, that we talk about appropriateness of measures, and that we include the population and not decide on top of people, which usually doesn't turn out so well on the long run. And that would be my last remark. Thank you very much.
Yes, well, thank you very much. Chiew-Ping, your final comments?
Thank you. So I think science-based policymaking is very crucial. About citizen participation, we have different types of population believe in different types of value, like say the notion of freedom. So safety over freedom or freedom over safety. So I think that has been exemplified through the pandemic in different parts of the world. So vaccine research, health infrastructure, we have no idea how it is going to look like. Building up a lot of hospitals in case of during non-pandemic time, it would be seems like a burden, but we have to make it convertible. South Korea is currently doing this. So, and Malaysia as our cases rises to more than 20,000 cases per day earlier this year, first half of this year. So we actually have no choice but to adopt the Hyundai and also Samsung technology in setting up that kind of makeshift hospital beds and camps. So, and in that regards, I think we definitely need more that kind of solution to face future pandemic. And most importantly, those pandemic-induced economic opportunities like SME solutions, digital solutions, financial solutions. So these are how we are going to come back better. So I hope that we absorb and learn each other's lessons so we can be truly resilient facing the next round of crisis. Thank you.
Yes, well, thank you very much, Stefan.
I would just like to echo what was said. It is important that there is a kind of community spirit which really helped Hong Kongers a lot. I think early on it was understood that you wear a mask, for example, not just to protect yourself, but to protect others, right? But equally important is sensible government action and the reliance on science, as we just heard. And I want to thank Tereza for organizing this, because the hope that we have is that we can learn from each other experiences. And I did find it frustrating early on that my colleagues here at the University of Hong Kong studied the effectiveness of masks, and those studies were completely ignored in Europe, in the Western world, where people were still advised that masks were ineffective, and they were told that because they were unable to source sufficient number of masks. But this kind of mismanagement of basic information, etc., has made the situation worse than it would have been. But so I too am kind of torn between anxiety and hope. I also believe that people are capable of learning, and it's not just a task for governments and the European Commission, but the people in all the member states. And I just want to commend Tereza on organizing this. It's fantastic that you did it. I think this is the way to go forward.
Thank you. Thank you for your words. Thank you very much. It's very kind. And to your very last remark.
Yes, so yes, I also would like to echo Stefan and say thank you for organizing this and also for the way you conceptualized the whole panel to bring different experiences, because I think as I was taking notes, I mean, I have keywords from every single presentation. It just proves that there's so much that, from a simple change, there's so much to learn from each other. But as a final note, I think I'll go back to the Taiwan model without being biased, because I'm here and I'm very respectful and admiring of what I see on the ground, and I see resilience and efficiency within its own context. So I'm absolutely aware that things need to be taken in their own context. This is why I also stress the importance of it. But out of context, I believe that one of the main reasons why it's been so good here and so efficient to contain the virus is transparency. And that is closely linked to communication and information. So to inform the public immediately from the beginning that there is a situation, what the government is doing, I think that was missing, or that is greatly missing in a lot of European countries at the central level and local level. So if we learned anything from this experience, is to be transparent and honest about how we go forward, to communicate so that people feel that they are in charge. Even today, when I speak to my family back in Europe, there's even today, after all these months and months of masks and vaccines and all of that, there's still so many questions, and I don't feel that there's as many questions here. So going forward, transparency, honesty, communication, and fighting disinformation is very key, both in science, but also in the politics of things. Again, that takes me to the power of authoritarian tendencies to use information against democracy. So I think I'll end on that note here.
Yes, well, thank you much. This is a wonderful conclusion of this panel. I would also like to thank to all of you for being willing to share your experiences, even though you may not be the nationals of the countries which you are talking about, or maybe that's why you have a bit of more objective views. And I hope that this panel did contribute a little bit to mutual learning between Europe and Asia and within countries in Asia. And, I think it would make for a wonderful special issue of a journal of what we have discussed. But in any case, I think it was very productive. And also, I think Julia nicely summarized some of the points like transparency, communication, and so on, which then brings us quite well to afternoon panel, which will be focused primarily on experiences on the Korean Peninsula and also in Singapore. And I hope that we will continue this discussion in the future for the benefit of Europe, Asia, but also globally. So thank you very much to you all for coming and sharing your views. Thank you.